And we may be seeing some light at the end of the dark pandemic tunnel as Kern Public Health says we could be getting out of this COVID surge. 23 ABC's Maithili Gubi joins us in studio now with an in-depth look at those trends. Maithili.
So according to data from the state, hospitalizations and cases are slowly decreasing here in Kern County. Now take a look at this. There are these four distinct surges that we see. There was one in July, the next one in January of 2021, one in September of last year, and then in January we do have that spike, but you can see that trend is coming down. There were more than 331 hospitalizations recorded on January 25th. That was the peak of it, and there were 100 less than that even yesterday. And this decrease applies to the case count as well.
I'm happy to bring your board good news this morning, as it appears our cases and hospitalizations have peaked from this fourth surge, and we are in the downward trend of disease transmission rates.
Kern Public Health Director Bryn Kerrigan says case rates have come significantly down in just the past 2 weeks.
Case rate was 81.5. At my presentation to your board 2 weeks ago, it was 178.3.
Looking at patients in the ICU, as of Tuesday, 43 people were in the ICU with COVID-19. It was 57 on January 25th. Now, Kerrigan says data shows that about a third of patients in the ICU are COVID positive.
With each of the four surges, preliminarily shows the severity of the symptoms appear much lower with this fourth surge than what we saw in previous surges.
Data shows the percentage of positive patients that were hospitalized has reduced with every surge of the virus. About 7% of positive patients were hospitalized in the first surge, about 5.5% in the second surge, nearly 4% in the third surge, and less than 0.5% with the current surge. Now, Kerrigan adds that the county does have additional staffing resources to help. The expansion adds 39 ICU beds and 33 regular beds as well.
We have 3 state staff strike teams consisting of 6 nurses and 6 paramedics on each team assigned to the emergency department in 3 hospitals to assist with offloading patients from ambulances and patient care in the emergency room.
Kerrigan is hopeful that we might not see another surge for some more time.
We continuously look at the state's modeling, and currently it does not predict a 5th surge at this time in the near future.
Now, the state's indoor mask mandate is being lifted after February 15th, but unvaccinated people will still have to mask indoors. Also, event capacities are going back to what they were pre-surge guidelines. For indoor events, the limit will be 1,000 people and 10,000 people for outdoor events. These guidelines go into effect on February 16th. Live in studio, I'm Maithili Gubi, 23 ABC, connecting you.